Yes, in the name of God, the compassionate of the merciful. Hello, my dear colleagues and audience. I'm Mariam Karabusi on behalf of a Student Engagement in Medical Education Unit of Education Development Center. I want to say hello to everyone and welcome to Learning Environment webinar. At the first time, I want to ask everyone to please do not turn on your webcam or your microphone during the webinar because we are streaming live on Facebook and all the webinar is recording. So if you have any question, please write it down in English just in chat box. Now, for the first, I want to ask Dr. Amir Ali Sohrapur, my teacher and our former Vice Chancellor of Education in Tehran University of Medical Sciences, to start the meeting and introduce our prestigious presenters as well. Dr. Sohrapur, could you please?
Sure, Mariam, thank you very much. Hello, everybody. I'm pleased to start this precious meeting tonight. This is one of the webinars in the series of Appraise to Raise. The title of this webinar tonight is Student as an Inevitable Part in the Learning Environment. I'm happy to introduce our special guest and speaker here, Dr. Jonas Nordquist, who is the Associate Residency Director at Karolinska University Hospital, Department of Medicine at Karolinska Institute, Sweden. Professor Nordquist is a professional in the topic of learning environments, including clinical nerving environments. We have had the honor to have him here in Iran and our university. I remember him visiting our new interactive classes at the Faculty of Medicine, and we were honored to have his comments about how to make the environment, the learning environment, better in order for the students to have more intake and better education. I am Amir Ali Sohrapur. I used to be the Vice Chancellor of Education till last month. I am a gastroenterologist and my place of service is at Shariati Hospital, Tehran University of Medicine. Dr. Mandana Shirazi, who is a professor at Department of Medical Education, Tehran University of Medical Sciences. She is an affiliated professor of clinical science and education, clinical science and education department at Karolinska Institute, Sweden. So she is acquainted to Dr. Jonas Nordquist from years ago, I should show my special thanks to Dr. Mariam Karbasi, who is Vice Chancellor of Student Development and Engagement in Medical Education Unit at Education Development Center in our university, Tehran University of Medical Sciences, who hosts us in this meeting. I would start the talks by a brief introduction to what the topic actually means and what do we mean by the learning environment, with a special focus on clinical learning environment. Just after that, I would invite Dr. Nordquist to, I would invite Professor Dr. Mandana Shirazi to have her talk about one of the experiences that she has had here at our university and abroad previously about outdoor learning environments and the impact it has had on teaching and learning. Then Professor Nordquist will have his talk about students' effect on learning environment, how the students would have effect on this. Then we will have a part for Q&A, and we will take your questions and give answers by the speakers. And then I would have a little wrap up at the end, so that I would give a summary of what was presented about in the meeting. So I would give it back to you, Mariam. If you are okay, I can start sharing my slides to have a very brief presentation on what actually clinical learning environment means and what impact it might have on education and students and residents' life.
Many thanks, my dear teacher. I want to ask you to start your presentation, and we are all here from you. Thank you so much.
Right. Thank you very much. So I would start sharing my screen. Okay. Do you have my slides?
Yes, we have.
Great. So I have to minimize this. Okay. Actually, this is my first slide. We are talking about clinical learning environment. I am associate professor at Tehran University of Medical Sciences. About the meaning of clinical learning environment, there are different different definitions about this. So what comes out from the words clinical learning environment. So we're talking about an environment which learning is taking place inside it, and actually we focus on clinical learning environment. The concept of learning environment is not confined to clinical settings. So in K-12, that means in students who go to elementary schools or high schools, their learning environment can be defined, and it is a very serious matter, and everybody tries to prepare a good, friendly learning environment for students to learn. But here, we're talking about mostly medical schools and the environment in which health professionals spend their time for learning. So clinical learning environment, according to Kelty et al. In 2017, is the social, cultural, and material context in which residents learn while they work. So every word has a focus and is to be focused on. So we have a social environment or social context. We have a cultural context, which is special to every culture. So the cultural context in Iran might be somehow different from the culture in India, for instance. And we have a material context in which I will explain in my next slides, including the desks and the ceilings and the rooms and the technical things, in which residents, the students, residents, or people learn while they work. So the clinical learning environment encompasses both learning knowledge and doing and practicing handwork and working, actually. Another definition, which is given by Macy Foundation, which is a foundation dedicated to education at Harvard University, says that clinical learning environment includes social interactions, organizational cultures and structures, and physical and virtual spaces that surround and shape participants' experiences, perceptions, and learnings. So here again, we focus on social things, culture, and structures, including physical and virtual spaces. Right now, after the pandemic has started, we all have experienced a vast space in virtual and non-real, but actually real electronic space. So the virtual spaces uh, uh, are an important part of the clinical learning environment. And the experiences, perceptions, and learnings take place in this learning environment. And there are evidence that a suboptimal clinical learning environment has been associated with adverse patient care and learning outcomes. When we come to clinical learning environments, not only the knowledge and the education matters, but also if you are training future health professional specialists, if the learning does not take place well, these people will have the duty to service to give service to people's lives and people's health. So patient care would be be, you know, if the learning environment is not good, the patient care would be affected. So this is a serious matter here at medical schools and medical universities. And another type of definition which brings it into mind, brings the learning environment, clinical learning environment into mind better is we have to look at it as an ecosystem of learning. An ecosystem, for instance, an ecosystem for the fish is a symbiotic environment. Different components of this environment affect each other. So here, people interact with concept, with the content, with what is to be learned, with technologies, different technologies, which are vastly accelerated to get higher and higher, and we're entering an era of AI and virtual reality and new technologies, and data that surround them to facilitate and deliver learning experiences based on some guardrails set by the organization, by the governments, by the imposed regulations that all this ecosystem is confined inside that. So we're talking about an ecosystem, including some symbiotic components. The learning environment, the clinical learning environment, literally consists of first people. People means learners and teachers. We have spaces, both physical and digital. We're talking about resources, including contents, supplies, and infrastructure needed to keep the environment healthy, and policies, the regulations, rules, and agreements, the procedures of the school community that support learning and teaching. So the environment is not only physical, is not only something related to spaces, not only related to the resources, but to the people themselves and the policies and regulations as the umbrella covering this environment. Actually, why is it important? Why is clinical learning environment important? Because it supports learning both directly and indirectly. It supports learning indirectly through physical and virtual facilities. If we have proper physical and virtual facilities, the learning takes place much better. If we have low-speed internet, if we have we do not have good resources, good infrastructure, a place where a learning friendly place physically, that would not be supportive, so the learning would be affected. Also, it supports learning indirectly via human and fiscal resources, as well as organizational structures and operations. And also, safe spaces are needed, are mandatory for supporting learning, and also thoughtful learning support is a need for the learning to take place. I would like to point to two studies which were done here at TUMS. One is a study who dear Nastaran, who is now a last year resident at our university in physical medicine, and then at 2019, she was a student here, actually a student in the last year for getting graduated as a GP. And my dear colleague, Dr. Farzad Fatehi, who is a neurologist, we did this study. So the title is hidden between below this ribbon. It is the prevalence of burnout in residents in our university. As you might know, we have three main general hospitals, which are Shariati, Imam, and Sina. We went through these three main hospitals, and we asked more than 200 residents in different fields of specialties. We used the Maslach questionnaire, which is a validated questionnaire for burnouts. And what we found was astonishing. Actually, we knew that burnout is prevalent in our residents, but when we saw these graphs, we understood that maybe more than 60 and nearly 90% of our residents are burned out. The three subcategories of this questionnaire, MBI scale, the subscales address emotional exhaustion, depersonalization, and personal accomplishments, which was very bad among our residents in all fields. And when we compare our results, which is down there, our study here, that shows more than 90% of our residents are actually have burnout, and we compare it to many studies around the world from different parts of the world, which would be, of course, these are high also. This is about 60% or 50% or 40% of people are residents of clinical residents who are burned out. Our figure is somehow outlier, and 90% of residents here at our university are literally burned out. So we went on and had another study, which is related to our topic here tonight, and we saw if actually is clinical learning environment associated with this highly prevalent burnout or not. And this is what we came out. We studied 221 residents. In this new study, we asked them again, and more than 60% of them had burnout according to the definitions. And our study showed that clinical learning environment was associated with burnout independent of personal characteristics. Maybe I have to explain this. Nowadays, especially due to what has happened after the aftermath of the pandemic, many of our clinical residents are under high pressure. And unfortunately, sadly, we lost more than 10 clinical residents due to suicide during the first 6 months of Persian year this year. That means more than 10 students, highly talented students who have been preparing and studying to become specialists and serve to this country have lost their lives just to suicide during past 6 or 7 months. That's a catastrophe. And many people here on the managerial and leadership positions are looking into the reasons and into the factors into the factors which should be manipulated, and the interventions are being under focus. So what I would want to fix on is that one of the factors which is important and could be addressed in order to make this situation of burnout in our clinical residents and students might be to look for the clinical learning environment and do interventions to make it right and make it more learning friendly. And our focus tonight is students and residents. Actually, our main audience are students and residents as well as teachers here. So this is what I wanted to this is what I tried to focus on, and I would give the stage to other respected speakers. I would like to be ears to think of what we can do to make the clinical learning environment better, so that we cannot witness such sad situations and events.
Many thanks, dear Dr. Sohrapur. And now we have Dr. Elizabeth Kechu here, and I want to say welcome to her. And we are here hearing about the experience of Dr. Shirazi about the learning environment as well.
Hello, everybody. I'm very happy to be in this meeting and webinar. I would like to say the story of myself, the story which is depending on the learning environment, and also regard it, the story start from the Sweden Karolinska Institute and finish to Iran. The title of my story is the experience that I have as outdoor learning environment as a learner and as a teacher. As you know, I'm professor of Tehran University and affiliated of Karolinska. Okay, my experience is from two perspectives. First, as a learner, as I told you, and the second part of the story is regarding the educator. My experience as a learner in outdoor situation start in 2011 when was the first time that I have participated in the BMJ leadership workshop that Yunus also was one of the facilitators, and we have many facilitators in this workshop, as well as Fiona Godley, who was at that time the editor of the BMJ. And the strategies that they used in their workshop was a student-centeredness, and the work process was outdoor and indoor education. If you look at through this picture, this is some picture that I took from the innovative art museum that they brought us in order to thinking and reflecting on what we are watching, and then discuss about the meaning of each of them. These are also some pictures. I brought it in order to understanding me better. All these things that you are watching here are some tires for wheel for the car. And my experience also in that part is this, again, parts of the museum and are visiting the museum, and she's Fiona. And my experience as a learner in outdoor situation was consist of two parts. First parts, we have also some education in indoor. These education were multifaceted and active teaching, such as mini lecture, journal club, case-based discussion. Then after the indoor education, we go through the outdoor education. And in outdoor education, we had some informal discussion through walking in the street in order to go for a lunch somewhere else. They consider the place that the restaurant that we would like to have a lunch over there a little bit far from Karolinska, in order to give us to reflect the topics that we that they have also teach us during the day. And then we discuss about different points of this what they have teach. And then for example, we have 3 persons, 2 of us were learner and 1 were facilitator. And after that, we go to through the Novel Art Museum that I have shown the pictures in order to get better my points, and then reflecting on our perception from in and outdoor situations. 2 students, and as I told you, 1 mentor or 1 facilitator in outdoor activities were together with each other. The number of facilitators were the same as the students. Then you can imagine that such a kind of that workshop running for us is very expensive. And also it needs some people who passed this experience, and also we should have the same idea. So what I did when I returned to Iran, every time that I come from Sweden, I bring some idea with me to Iran in order to contextualize it and use it in our own context. And also we write an article regarding the results of one of our outdoor meeting, an outdoor concert that we have submitted and we staying in order to see what will happen to the result. An outdoor concert of learning in medical education, my experience as a teacher. Then my role was changed. You can see in the first time that we go to the outdoor meeting, however, we had several outdoor meetings after it, but it was the first one that we go, we have Dr. Kavasi also here, and also my other lovely student that I'm a teacher who love really my students. And I'm sorry to say that one of them is not between us at the moment. The coronavirus last year, we lost her due to coronavirus. I'm so sorry. We have some tips for an outdoor experience as a teacher in Iran, because we couldn't, implement as the same as what BMJ did for us in Karolinska. So in our context, we should modify some parts of it. The modification was based on our cultural context. We have different number of facilitators. We haven't the same context that they have considered. So we consider our situation and also our empowerment in this case. Implementing more than 10 during this time, before COVID, we had 10 outdoor education events for medical educational PhD candidates, hopefully. And a student in all the program, when I talk with them after the program, they were satisfied and happy. They consider it as a fun. However, our education happens in, for example, in park, in workshop. It depends on the situation that we have available. And also we are publishing the result of first outdoor educational experience. Now I would like to tell you the purpose of our paper that we are publishing. Outdoor can benefit students of all ages and successful in a variety of settings. Furthermore, it can enrich the curriculum and improve educational attainment. We try to explore experience of PhD candidate in medical education, after the events. Material and methods. All the data were collected from PhD students who participated in that event, and the method that we use were focus group. Then for analysis, the data, we use content analysis, and the results of our finding of our study was 15 PhD students participated in our focus group. As the content analysis of data, we found two categories of instructional and inspirational, sides of outdoor learning, which were emerged with their and four subcategories respectively. The conclusion of our findings from the first meeting of outdoor was it is recommended to include the outdoor learning experience to provide situations for research and practice. And also it should be noted that curriculum reform might be necessary for planning the outdoor learning environments and associated teaching learning methods. And now my story was ended. As I told you, as a summary, I would like to say that, as you remember, the story starts from Sweden, and I learned many things of that meeting, and then I bring it to my home country and make it some contextualization and use it for our PhD students. However, I have used it for each PhD student for one time. I mean, each course, each entry of PhD student just one time, because it's not easy to handle this kind of meeting in some place out of the school. And I intend to continue this process, and also with art-based education, I intend to expand my experience in this area. Thanks for listening to me. I wish the best for all of you and hope to have you in another webinar. Thank you very much. Then I will leave the mic to the Jonas.
Right, here I am. Good afternoon, everyone. Thank you so much, Amir, and thank you so much, Mardana, for those wonderful remarks. It's interesting when I think back that I quite remember very well when we had at BMJKI workshop here at Karolinska a couple of years ago. And it's interesting to see how space can be so much. We're looking into art museums, we're looking into hospitals, we are looking into just outdoor parks and what it actually means for formal and informal learning. Amir, I think you did an excellent overview of the whole topic of learning environments. And I think that was very, very good to set sort of the stage. A couple of years ago, I was sharing a global consensus conference on clinical learning environments run by the Royal College of Physicians and Surgeons in Canada. And what we did was that we published a special issue in medical education on clinical learning environments. And as you do, I mean, that was just after the Mayo, the Mayo group came up with the report, and obviously quite a few of them also participated in our work. But what you tend to see is that it's such a slippery concept when you look into clinical learning environments. And I think that the definitions and the way you approach it is absolutely perfect. Back then at the Royal College, the way we try to conceptualize learning environments is not really just trying to define it, but we looked into it from various perspectives. So we looked in from like different avenues. So we were looking into the education avenue, the psychological avenue, the cultural social avenue, the architectural architectural one and the digital one, and one about inclusivity and inclusiveness. So thank you, Amir, for that wonderful sort of opening. What I want to do now is I want to approach what I'm going to speak about from two of those avenues. I'm going to speak about the physical learning environments, the architectural avenue, and I'm going to speak about the digital avenue. And the inroad here would be students' effect on how we think about these types of environments. So let me see where I have my slides. Here I have them, and I am just going to project them. So what I'm going to do is that I am going to look into students' effects on these particular environments. And as you can see here on my slide, I have two ladies. One of them is from 1880 about. It's an impressionistic painting that is very well known, and what you tend to see here is a woman who sits on a balcony in an opera house somewhere, most likely in Paris, and watching the spectacle going on stage. In the other, on my other image, you see Maxine Mawhinney, who is a news presenter at the BBC. So these two images will represent my inroad to today's topic, students' effect on learning environments. And I'm going to speak about two types of environments I haven't been speaking about before, because the pandemic really has forced us to rethink. I'm going to approach this from a digital perspective. What does digital environment looks like? Digital learning environment, what they look like, and what are students' impact and inroad into this? And also the physical environment we're used to, and the wonderful physical environments you have in Tehran. I very often show images from your wonderful education center, where you have all those tables at different tiers where students actually interact. And I think it's a good example to show the world in terms of what wonderful work you have done in Iran, trying to conceptualize and to think about how space can be transformed, and also transformed into an active and peer-to-peer based learning curricula. So bear with me, let's go. Let's begin to think about the case of COVID. McKinsey Global Institute, they came up just this year, earlier this year in April or March, they came up with something called the Physical Proximity Index. And the maximum score you can get of the Physical Proximity Index is 100. And what they've done is that they looked into various industries and various sectors, and they tried to estimate the proximity index, the physical proximity index. And as you can see in our industry, medicine, you have a very high index, you have 87, which means that the contact between people is quite key. It's very difficult to run healthcare if you don't meet people, if you don't interact with people, patients, relatives, staff, other physicians, etc., etc. But also personal care, social care, looking after elderly and social care in many respects cannot be done digitally in most cases. So also here you have a very, very high physical proximity index. And then it just goes down, 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 down. But when you look into computer-based office work, you have an index of 68. That is quite high. That's still quite high. And if you look into what we do here, classroom teaching and training, you also have an index of 68. And what all of that suggests is that there is a case for close interaction between human beings in the same physical space. And if you think about this from the perspective of COVID, what has changed? Can we think today in the middle? We're not done, ladies and gentlemen. We are not done. We are in the middle of the pandemic, and no one of us will be able to predict whenever it's going to finish and we will be on the other side. So at this point in time, when we think about physical learning environments and learning environments in general, COVID must be taken into account. Otherwise, we will not be authentic. And that has a huge impact on the way we think about design of classrooms, but also how we interact when we do not meet physically. And interesting enough, students and students' effects on learning environments, students have in this regard been very proactive, and they've seen around the corner to a degree that many of us who are senior in the faculty may not have actually been able to anticipate and be able to do. So why don't we begin then with the digital environments? And I like to address this from the perspective of future classrooms. So where we are now, we dive into learning environments, we look into the physical learning environments, but to think about the future classroom, you cannot limit yourself only to what we call the architectural one, that would be the physical ones. You also need to take into account the digital learning environments, because that is also an environment. And how do we create space for teaching and learning here on the global internet, on a platform like Zoom or Facebook Live or whatever it might be? I provided a little bit of I guess a beginning to it, an attempt to create some kind of model when we start to think about this. Because as you can see here, we have on the one side, we have the face-to-face classes, and that would be traditional teaching, the one I grew up with, and I presume the one you grew up with in the context where you went to school. And what type of environment, architectural environment, would we then have? Well, we have obviously built environment. We have the classrooms, we have the lecture halls, we have the seminar rooms, etc. And this is where your case in Iran, and in particular in Tehran, comes about, how you have redesigned in a very successful way, which is a role model for many of us. You have designed your classrooms to fit the new way to think about teaching and learning. Ta-da! But then came the virus. And what about the virus? Well, Karolinska, as many other places, had to close down. We went into a lockdown and we could not access campus and the other learning environments we did have on campus. So we then went into a digital-only environment. And then the question for you, ladies and gentlemen, is what type of physical environments would we interact from? Well, I think there are two ways to think about this. One would be that we have home to home. The faculty member could be home in his or her home and then broadcast like we do today over Zoom or Teams or any other application, WebEx, whatever, to students that were also in their own home somewhere else. So the physical environments here would be home to home in order actually to give lectures digitally. Another version of this is that the faculty member would go to his or her office, or it could be the hospital as well. So he or she gave classes from the hospital and from the office to students where they normally would be in their own homes. So we can think about the digital-only environment would contain either home to home or home to office/clinic. In a hybrid environment, we have seen quite a few examples of those right now. We see classrooms, and we have some students in classrooms, some connect to the Zoom and participate from home. So it's a little bit of a mix between, and it's difficult, it's super difficult to adjust this from a teaching perspective. I mean, how are you going to relate people on Zoom and people also in the room? So this is a huge challenge from a teaching and learning perspective now, how to think about it. So here you might have two physical environments, homes where students are, some of them are, and you have a classroom. But that classrooms need to have cameras and microphones to make all of that happen. You might also think about you have homes, and you have specifically designed classroom studios. So it's not just a regular classroom, it's actually a classroom studio with better lighting, with better microphones, and more cameras established in that space. So it becomes a little bit more like a production studio. We can also think about conferences here, but I think that in the interest of time, I will leave conferences aside for the minute. But it's the beginning of a typology I am working on right now in terms of what did COVID do to physical environments, because they are there, but they're very different from the ones and the conversation we had just some 24 months ago on the same topic. What we have is that if you look at it, what does it look like? So this is, if you look into home to home, this is what it could use to look like. You see a group of Swedish students here, and you see their home environments. And I gave you a picture of my home studio. You see one of is myself up here. And what you tend to see is that you went straight in to our students' homes. You could see their messy backgrounds. You could see the gentleman up here. You could see his kitchen. You could see her sofa, etc., etc. How professional is this? And the lady on top in the middle, the one with the earphones, she is running this show. So she is the faculty member for this particular class. And look, you see her dull working room, I guess, and you see her bookshelves. Now, it works technically, yes. Some people had black screens, but yes, it works technically, and you can communicate. But look, how professional does all of this look? Is this how we would present ourselves in a public space? If we went to university, if we went to a conference, is this the way we would look? And is this also the kind of impression people will get of who we are and all these things? Look at this, ladies and gentlemen. This is a photo I took from my cell phone, so I apologize for the poor quality of this particular image. But this one, this is from Art Basel. Art Basel, ladies and gentlemen, is the most exclusive international art fair in contemporary art every year, held in Basel in Switzerland. Here they sell art for millions and millions of dollars. This is big time in the art industry. And Art Basel, as any other big fair, would have their own conversation with important people. And since they could not be in Basel, they participated here on Zoom. Wow. Are these reps for the representatives for the high-end art market? Look at the gentleman up there on the right-hand corner and his very messy office. Look at this lady below sitting in her car. Look at these other people. Are these worthy environments? Are these worthy to be replacement in the digital era? Because this image you see here is digital, but it's digital only to the degree that people participating in this digital classroom encounter are physically located somewhere. And here you see what all of that looks. Now, look at this guy. He is fabulous in many ways, but this guy, he is chair of a European Society in Gastroenterology. And here he introduces an international conference for 1,500 people. He doesn't even look into the camera, and he has most likely a well-worn polo shirt that looks a little bit in between colors, should we say? A little bit in between colors. It might have been green in the early days, but now it looks a little bit more in between colors. How worthy is he to be the president, giving the opening keynote and welcoming guests when he sits there in his in between colors polo shirt, most likely in a conference room somewhere, and also he doesn't even look into the camera. Now, where would students come into this and students' effect, you might wonder? Well, I would argue, as we see here today, we are live on Facebook and we are also recording this particular session. We have now moved from the digital space, good to have, to need to have. And to you, who have been really, really driving this? TikTok, YouTube, Facebook, LinkedIn, just Insta stories, you can just mention it one after other, or any other social platform you may or may not use. It's not been us. It's not been us who are the senior faculty. It's been somewhere else. It comes from the youth. It comes from above. It comes from the emerging students. If I look into my family and I look into what my son does, he's 17 years old. I look into my two daughters. They are 19 and 22. Look, they are, and we have said this over and over and over again, we are digital natives and we are digital immigrants and all these other things. Now, this is true because when it comes to actually transform this kind of digital classroom into a much more professional production, that would be the students. Students had a huge impact and effect on the way we think about it. Look, internet is not going to be much different in terms of what we can do when we broadcast as we do today and when we stream. But where we stream and how we actually create our productions, that's another story. So using various cameras, the sound, the light, the backdrops and the background, all of that goes into production. And if you were to look into students and what they can do with their own laptop and what they can do in terms of producing small films, setting up a studio without lots and lots of money, they have, to a very, very high degree, I would argue, been driving and are driving the development, the way we think about recorded videos that we may produce as a teaching and learning resource, making it available for students, but also how we actually present ourselves and how we create a professional encounter out of a Zoom room like the one we are in today. And you can hear my opinion. I am not of the opinion that this is professional, neither is this. This is not what it should look like at all. This is what it should look like. This is what it is. Classrooms, look at the light, look at the backgrounds, look at the production, look at how they sit when they are in these particular spaces. Look at all these things that goes into it. This is the TV industry. This is global broadcasting. This is for the BBC and it's for Celebro Media, and it's also from a program called Dateline London, and you'll see here what the backdrop actually looks. And the good news is you can do this. We can do this when we furniture, if you like, our digital space. Even if you participate from home, still you can furnish your own place. What is your background? What type of light do you have? What type of sound do you have? How are you dressed, by the way, when you present, even if you are in your home environment, and even if you are broadcasting to students and you think you're actually offline. Here, students can show us the way, and they have a huge fingerprint and a footprint on what can be done with very, very small resources. It would not take $1 million to fix up the background, to fix up the way they're sitting, to fix camera angles, to get proper sound and to get proper lighting. That would not be a very big investment for any of those gentlemen and ladies on that particular image. The same thing applies, of course, to what you tend to find at university. So my argument, I guess, is that we need to think carefully about the digital environment. The digital environment is not just being able to connect to Zoom and being able to be here and to break out into breakout rooms or whatever it might be. It's also a question about the experience we want to communicate and the level of professionalism and the level of, the level of how you want to present yourself. that is something you are in control of when it comes to physical on digital, no, not physical, the digital learning environments. And just look at any clip you can find on many young people that just upload to any of the social forum, very professional small clips, and they don't have the money that you find here. Now, I like to leave the digital space for a minute, but I think that it's impossible today to speak about learning environments if we do not take into account the physical, the digital learning environments, because they're here. And when we did the work I did as the chair of the Royal College Conference back now in 2018, at that time, we had the digital avenue as one of them, but the sense of urgency here over the last 24 months or so has been absolutely astronomous, and there is so much more to do in this particular area. Having said all of that, I have not, many of you have met me physically when we were in Tehran a few years ago. And having said all of this, look, I don't have COVID. COVID has not sort of disrupted my brain in a way that I would not argue that physical environments also are important, because they are. And I think there's some interesting recent developments I want to share with you. And again, I think that we have to look into the student experience to understand this a little bit better. And there are two aspects here I think we need to take into account. One would be the actual experience of the space. Is it inviting? What about psychological safety Amir was addressing earlier? What about the possibility to interact with other students, to interact with the faculty member, etc., etc. So the whole scenography of the experience is still absolutely key. And I guess that's what I'm also looking for when it comes to this. This experience you see on the, how do you experience this? What's your feeling when you see spaces like this and you see people being broadcasting like this? I would argue it's a completely different feeling, and it's a different experience to participate in something here compared to participate in a space like this. And that also applies, of course, to the physical learning environments. I think that experience is one. The second thing is that the space, the physical space, needs to elicit high energy. High energy and a wave of enthusiasm and engagement is important if you want to have an enlightened conversation with your students. Not just a one-way show, but actually a conversation with your own students. So the question then is, how can we find input into spaces that provide a rich experience and spaces that create high energy? Ladies and gentlemen, I like to invite you to performing arts, and I like to visit with you today to fictional spaces, or spaces that create fictional spaces. And I think that Mandana so wonderfully took us to the art museums and highlighted what can be done in the extended classroom that is not perhaps a space we think about as a classroom. And what I want to do, I want to continue in Mandana's wonderful introduction to the topic of art space. And now I'm going to take you not to a vision art space, but to a space for music. I want to take you to the opera. And I want to bring you back to how you actually design spaces for performing arts. And I have to say that when I go to Kuwait, I go quite a lot to the Middle East, but obviously I haven't been that far over the last 20 months or so. But I used to go to Kuwait quite a lot, and they have this most wonderful art center for performing arts in Kuwait, and they really nailed it in terms of how to think about design of various types of studio spaces or various types of performing arts spaces. But let's not get lost in Kuwait. Let's look into this. These are two spaces. One was opened in 1875 and the other one opened in 1876. So one might argue that these are developed at the same time and they are sort of siblings in a way. One is in Germany and the other one is in France. What you see here on the left side of the slide, the one where you see the red seats, that is the Garnier Opera in Paris. And the other one would be the Festspielhaus in Bayreuth, where they play Richard Wagner every year and the Ring and any other of his opera performances. And it doesn't matter whether or not you are acquainted with these types of opera traditions or not. But I want to show you here, and that sort of really translates to all of this. It's the design of the space. On the one side, if you look into the first one, the one with the red seats, the one in France, you see a quite interesting space where the sight lines are not 100%. The sight lines are difficult to actually get everyone to see the stage properly. And you have as a very vertical space where you have like 4 sections on top or the stalls down here. You have this orchestra in between the stalls and the stage, and you have that big sort of stage curtain coming up and coming down. This space, back in the days when this space opened, when they played opera, they kept the lights on within the theater so people could see each other. And you see all those balconies here. Just to be in the theater was a theater in itself. So you walked in and it was like a social space and you saw people on the various balconies and you interacted with people in that particular space. So the space as such is a theater of a theater where people show off basically by participating or just walking in to a performance, and the lights were on during performance. What do you think happened here in terms of being able to communicate what happened on stage with the audience and create connections, etc., etc.? If you compare that to the other one, you will see that on the Festspielhaus in Bayreuth, it's a much flatter space. And here it's designed to have perfect sight lines for everyone. That is not the case of the Paris Opera. But here in Bayreuth, it should be as flat as possible. So even the upper seats should be as close to the stage level as possible. They did not want to have people look down on the actors. They want to have them sort of on the same level. And you want everyone to see, so it's completely differently designed. Also, seats here are not as comfortable as the ones you see in Paris. The idea was that you did not go to the theater to fall asleep. You went to the theater not to be too comfortable. The seats are a little bit hard-ish, so you should stay awake and should be focused on what happened on stage rather than anything else. So what happens here also was that when the performance started, they took the lights out, they switched lights off, so it became dark. So people should focus on stage rather than on other spectators in the same area or in the same box or wherever you might be. So the bottom line is that I would argue that it's been studied quite carefully, social interaction in those spaces, and there are some factors that pops out. And intensity of the space is closely connected to the way space is being designed. And high energy is absolutely key for the overall experience, of what happened, overall experience for what happens in that particular space. And there's a lot to learn from theater design and what they've done in this particular case in opera houses. And this is the book that actually looks into this particular topic. And when you look into it, and we don't need to go into details here, but I think it's important for us to think about what are those spaces that elicit high energy. And you might think about wherever you are in Shiraz or anywhere you are in Iran at this point in time, or in Kurdistan, or wherever you might be, what are spaces that elicits high energy? How would they look? How were people seated when you actually get that sort of tight interaction between participants, but also between participant and faculty members? So from my end, I think that connected to all of this would be the other more informal spaces that Mandana brought up so nicely. I loved your example, Mandana, when you spoke about what happened to the students when you were outside, what happened when you went to the restaurant outside the formal classroom, what happened when you went to the art museum, which is not one of those sort of formal spaces, it's something else, it's an informal space. And unfortunately, what we have in healthcare would be lots and lots of corridors. And where are all those spaces where people can interact informally? And I think that you are so lucky in Tehran, and these outside spaces you may actually open at Tehran University, in the courtyards outside where the old lecture theaters used to be and where you now have your student center. But it becomes like a corridor, an informal space, a space where people actually, it's a transactional space. People walk and they transfer in between buildings and they become like a social hub. And these are super, super important for student learning and for informal learning encounters. And I always speak about that, and I spoke about that when I was in Tehran, and I'm speaking about it today because COVID did not change that. Although, of course, we need to think about social distancing and all those rules that applies to that. I just want to finish off with a few more slides, and then I will leave it over to our wonderful chair here today. I love it. I absolutely love this particular image, and I might have shown some of you this image before, but I think it's so simple. All those sofas, this is from an art museum, by the way. So Mandana, I promise to take you there when you're back in Sweden again. I'll take you there, and it's a fabulous space, and it's very, very low budget because all those sofas were on its way to the rubbish bin, but then they were collected and that's put in this particular museum. And I think that in terms of experience and what it communicates, I think it communicates a sense of creativity when you step into the space. It's low budget, and I love it. I think it looks really fabulous. But the type of intensity and the type of high energy, this is your space. And the fact that people can sit in the same sofa is very different from when they sit on individual chairs. And as you did in your wonderful student center, you have many small tables where they can interact in small groups. This is a lecture theater, right? So it cannot be compared to what you've done in Tehran. But when you place students in the same sofa, they become like a defined unity or entity within that overall space. So in this one, you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 groups. Bloody hell. Oh, you had 11 groups in this particular space. Isn't that absolutely fabulous? 11 groups of just by people stepping in and sitting in this particular space. And think about the kind of interaction you can get if you ask people to interact in between them in that particular space, and also then in between the groups. So I think that intensity on the one hand, but also the overall experience, it doesn't need to be more complicated than you actually can find on this particular image. And from a student's perspective, I'm quite sure they would very much enjoy that particular space. What you tend to see now is that many offices are kicking out the desks. They are moving into other types of offices, and this is what it could look like as different forms of layout. It becomes like informal, but you also have formal seating, etc. These are expensive. These are expensive sort of moderations they've done. But what it does is clearly shows that the whole idea about encounters and the informal learning that Mandana brought up is here to stay. And even though many of those have been empty during COVID, still when we come back to office, office becomes a space for social interaction rather than for work or sort of concentrated work at the desks. And I'm quite sure that in a university setting, this is also something we need to bring into account and think much more carefully about. So in my closing remarks, I want to close off by saying that the overall topic, students' experience and students' impact on learning environments, have been huge. Students have been driving the furnishing, the digital space. But I also think that the whole notion of intensity and the overall experience is something students are driving super, super strongly. And the thing is, if we fail to define those spaces in a nice way that actually aligns with the values of our students and the kind of spaces they prefer, they will leave us, they will go somewhere else downtown or in any other kind of urban setting or to another space. So I think that at least in my work and what I've seen around the world clearly, where we have gotten most of our input from and people that truly be our beacons and also our inspirers here, that would be the students, because if anyone would know how to furnish a digital room, students do. And I think that we can learn from broadcasting, we can learn from the film industry, we can learn from performing arts, because we also need to take our own responsibility to make sure we furnish our digital spaces. So on that note, I think I will hand over to our fabulous chair. Thank you very much for having me. I love working with you all.
Thank you so much, dear professor. It was so great, and I was so happy. Thank you so much. And Dr. Sohrabpur, could you please start the Q&A part?
Yes, a pleasure for me. Okay, we can take questions both in the chat box and orally. If anybody has questions, please raise hands or announce in the chat box so that we can take some questions. Until we, Mariam, dear Mariam, please help me catch the questions.
Yes, dear doctor.
Okay, do we already have a question, or I can have my question or my comment about what just we just heard in the fabulous talk of Dr. Nordquist?
Yes, please, please, doctors, you can start, and then we have some question, and Mohammed Amin will ask his question, but please start.
Yes, I just wanted to give a comment about, I used to follow an account on Twitter. Of course, I can't remember the name, but at the start of COVID pandemic, what it did or used to do was to catch or capture pictures from different people in different meetings, Zoom meetings, maybe around the world, and it made a short critique about the background. So this account consisted of maybe 2-3 tweets every day with a picture of some guy or somebody having a Zoom meeting, and it talked about what we can see in the background, and actually it was a very complicated technical commentary. So some sceneries, some decorations, bookshelves, and etc. And I remember many comments under each tweet, and people gave comments about the pros and cons of the background, and it was actually very interesting. And And you could see that what impact the background has on the people, on the audience. So if I, as a gastroenterologist, if I am talking about digestion or peptic ulcer disease, the book behind me and on the background maybe has more impact on the audience than what I actually say. So it was very interesting what we just heard, and I have to thank Dr. Nordquist very much for this precious lecture. This is recorded and actually is a masterpiece class, is a master class for all students and teachers. Okay, have we got questions, Mariam?
Thank you so much. Yes, Mohammed Amin has a question. Could you please start?
Sure.
Okay, raise your hand, please.
Hi, do you hear me? Do you hear me?
Yes, we have your voice.
Hi, thank you for all the professors which gave us lots of notes about medical education and learning environment. I won't take a lot of time. I want to ask some questions as a representative of the students working in some work groups of our Education Development Center of Tehran University. And I want to take your time if you could answer some of these questions and know about let us know about your opinion about these.
Thank you very much. It's very kind of you, and we are all ears to hear your questions.
You're welcome. What are the elements of a virtual learning environment at home for learners? And how can it be developed? This is my first question. If you could talk, or we could discuss about it and reflect more about it. And the other is, what are the challenges of managing a learning environment in the era of COVID-19?
Right. I think that that begin with the first one. You can actually do quite a few things simply where you are back home. One thing, all right, I'm going to teach you something. I'm going to teach you something that you can, but don't tell anyone. Okay. If you think about the small screen you have in front of you, each and one, if you just look at the screen in front of you, okay. Now we have just hundreds of black boxes, but for those of you who are privileged to have the camera on, you will get this much better. Now, if you were to have a ruler, if you were to have a ruler and you divide your small box into thirds, okay, of equal size horizontally, okay, so you have three different levels. Okay, your your eyes should be on the line between the upper and the middle section. That's where your eye line should be. How difficult is that? Well, you can push your computer and hello everyone. Now let me speak to you like this for a minute. I can even sit like this for a minute. Even though shouldn't I speak like this, because you are in Tehran anyway, and I speak to you like this, and I sit here and I have my eyes like this, or I straighten up and I'll come back to you and I sit here and I look straight into the camera. Okay, now can you do that? I guess you can. Is it difficult? Yes, no. So you can actually make your visual presence so much better just the way you put your computer. Bingo. How difficult could that possibly be? And you just divide it into thirds, because I'm going to teach you a swear word here today. I mean, don't worry, it's not that kind of swear word, but the swear word is, okay, listen carefully, you are visually diminished. That means that you are visually diminished, and this is being visually diminished. And if you find yourself that you are like this, you are visually diminished. And if you do, you lose credibility, you lose credibility, and you lose authority. Even if you can be as much professor as you like, you're still visually diminished. And what you want to do is that you want to feel, when you speak to people, you want to make sure that people actually feel your physical presence in terms of how you actually fill up the square. So that's number one in terms of your visual, in terms of visual presence. Now, very much related to this goes into backgrounds, and clearly no advanced backgrounds. And I'm afraid I've seen too many kitchens, and I've been seeing too many bookshelves over the last 24 months, or even worse, but that's not what I'm going to tell you live. And from that note, you definitely want, number one, to have a protected back. You want to have it protected. So you don't want to have people walking in to into your camera. So the way I have a wall just behind me, and there's no way people incidentally can walk in to this particular streaming we are a part of now. I am at this stage, I am not in my studio. Normally I would never ever give a lecture from where I am, but today it couldn't help because I've been somewhere else, and I just gave another lecture in another part of the world, and here I am. So I am not where I normally is. So the light here is awful. In my studio, I would have good light. I would have proper light. And I guess that most of you would be where I am, in a typical setting where I am now. I guess many of you would not work in a studio as I do. And when I didn't used to work in a studio, but it happened, I couldn't travel and I couldn't teach. So I was teaching from my home, and I transformed that into my teaching studio. And in terms of you guys, you can look super fat very simply just by the way you put your light. And one thing you never want to do is that you never want to be backlit. Light should never come from back, should always come from front. Unfortunately for me, it just comes from above because I'm in that type of setting at this point in time. So if you can get the lighting coming into your face from the front, but not from the back, and certainly not from the sides. That is another thing you want to do. You never want to be next to a window. So you don't want to have a window behind you, because then you're backlit. You will look ugly. And even if you are Miss Universe, you will still look ugly because when light comes there. So I think that from that perspective, there's so many small things you can do to furnish your own sort of home environment. And also the kind of backdrop you have must be neutral. And since I'm on another computer at this point in time, so this is not my home environment, I just quickly uploaded this one, which is just from a lake somewhere in Sweden. So hopefully it's a restful one, but you shouldn't think too much about the name of that lake. You should not focus on the lake. It's just a backdrop in order for you not to see sort of the whiteboard just behind me in real life. And Zoom just allows us to upload those images. But once you have the images, it's important in terms of the way you're dressed, because you don't want in a professional setting to look like the ones I showed you. You want to remain professional. And blocked colors like blue or white or any other color helps you to stand out from your background, because you don't want to be this bow tie. It's okay because it's not too busy, but if it was slightly smaller spots, it might become busy in the camera. So just a few things to think about. Can you have like a jacket, or can you have anything black on, which might not be too difficult in your context, and sort of something black would actually help you to look good in these. And it's just small tips that will take you like miles in terms of making you look good when you actually teach your students, and make you look like a professor. Because you are. But you can easily look like you're not.
Yes. These points that you refer to are absolutely simple to do them, but they highly improve the learning experience of the students. And I think as they are so simple, they have a high impact, and should try to, for example, create a checklist, create some quality assurance of some of these simple things to keep our learning experience high. Thank you for your time.
Can I just give you one more tip? And that would go into the slides, because just think about the slides. How simple are your slides? Because when you prepare your slides and you go into a classroom, they might be busy. But if you have a busy slide and use it here in Zoom, take into account that the majority you can't see it here. I pretend I have a cell phone. Yeah, you can see this is supposed to be that disappears here. This is my cell phone. And what happens is that many students, when they participate on the tablet, or they participate and they look into the cell phone. So if you have a busy slide in real life, it becomes almost impossible to detect when you actually watch it on another device. And I think that's also something to take into account when we think about, because live is different from being in the virtual space. You cannot copy paste what you do in real life and apply it online. You need to rethink the whole sort of duration of the event, but also how you present yourself, but also how you prepare your slides. Thank you.
Sure. Thank you a lot.
Thank you so much, dear professor. And Dr. Navidinia has a question. He said, some students are very reluctant to turn on their camera in online classes. The question is how we can encourage them to do so.
Yeah, in our case, just force, simple as that, force. We do here at Karolinska, it's quite simple. We wouldn't say that, you have to. That's not the way we say. What we say to them is simple. For those who, well, let me put it exactly, but we do respect that there are some people that are shy of showing the faces. We completely understand and sympathize. However, if you're reluctant to switch your camera on, you are welcome back when we go live again, maybe 2035. So until then, we keep you on our short list, but you're invited back, but you cannot stay in our virtual environment unless you show your face. Full stop. And if we have someone who don't, we disconnect them.
Thank you so much.
I'll send you like an email once as Eunice, turn your camera on. Please turn your camera on. And if Eunice doesn't, what's going to happen is that, bye-bye.
Great. Very good tip. Actually, I'm enjoying every tip Eunice is giving. That's very important because before we come into the Zoom environment, body language and the inspirational themes and the energy we use to inject into the class played a very important role. Now we just have a rectangular box here, no more than that. We used to give comments in the communication skills classes that please use every inch of the stage you're standing on. Just take your mic and walk around and maybe, of course, come down from the stage and walk through the class. Right now, I have just this rectangle. So there needs to be innovations to make people stay awake, give their hairs and mind and to you, and inspirations to you. So that needs a lot of that needs art, that needs performance arts to help this knowledge transformation.
Amir, look, do you feel I look at you now?
Yes, now.
And now?
Not actually. I think I understand what you're trying to tell me.
What?
Maybe
What is that?
Maybe a tip, not to be like that, huh? Maybe, I don't know.
Well, look, in this case, I'm looking straight at you, but you don't feel it. Now, I don't look at you, but you feel I'm looking at you. You know why? Because all of you here today who want to top up your game in terms of digital teaching, you must find a new friend. And the friend you need to identify, you must love, and that's a dot on your computer where the camera is. In my case, it's green. It could be red in your case. And when I look straight at the dot, you feel I look at you. But when I look at Mandana, who's down here on my screen, she doesn't feel I look at her, because I look at her on the actual screen where I can see, but that's not where the camera is. So I think that for each and one of you want to top up your game, think about someone you really deeply care for and someone you really, really, really feel passionate about. Try to identify that person as the dot. So when you, because look, I'm sitting in a silly conference room at the hospital. I'm alone. No one is here, and you are all over the world, and I'm here. But in order to get sort of the energy and sort of the contact with you, I have to imagine that that dot is someone I speak to. It might look utterly ridiculous to record this and say, here's this old man sits and he speaks like this in front of the camera looking into the dot. But in order to that work on the other side of the screen, you actually need to communicate with the camera and not to the actual face of the person on the screen, because he or she cannot see that you're looking them straight into the eyes. Simple, doesn't cost lots of money, but it makes a huge difference.
That's great. Thank you for the tape. Actually, one of our audience has written down that we are in a developing country. We have confined resources, so we can't have luxurious environments. What Dr. Nordquist is telling about is not about luxurious halls or very high-tech cameras. These are just very, very important, apparently simple, but very, very important tips that need no money. So we have to, these are what we have to do in order to have the better or most impact on our audience. And these are not luxurious. And so I think this respected guy has taken his response from Dr. Nordquist now.
Thank you so much, yes,
Next
Doctor.
question.
Yes, Dr. Elizabeth Kacher has some question, and we have her here. She said, thank you for this excellent presentation. Outdoor education as well as virtual spaces can stretch professional boundaries, and how we can, let me see her comment. How can we prepare learners and faculty for these changes?
Well, I think that is my perspective. I think that the good news is with the pandemic is that we see many more participants from all over the world. Where we had a conference with Royal College last year, someone who couldn't quite connect. After a while, I asked, "Is there an issue with your internet connection?" No. I'm here in a bus in Kigali, and I think it's absolutely wonderful to see that we actually can reach an audience that is much more diverse than it actually used to be. And I entirely agree with you, Amir, because all of this, looking into the camera, if you have a cell phone, if you're lucky enough to have a cell phone, and the cell phone has a camera, that's a home run, you're good. If you happen to have a laptop with a camera, you're good. That's what you need. A cell phone with a camera. If you have a cell phone with a camera, you look into the camera. That is not developing or not developing country, just looking into the cell phone, if you have a cell phone. The way you position the cell phone, if you then connect to like Zoom, and if your cell phone allows for that, you can actually select background. That is not a question about money or not. I mean, if you have a cell phone, that actually works. So I think that the light, if you want to stand behind a window or not, that is not something you can do it in the US, you can do it in Sweden, or you can do it in Kazakhstan, or anywhere. I mean, it's the same thing. So I think that the good thing with the digital classrooms really is that it equalizes the differences, because when you look into the physical environments, you are very fortunate to have that wonderful center you built. That requires resources. Here at Karolinska, the physical environment requires resources, but how you actually appear and how you connect in the digital world, because the cell phones are so advanced, it levels out the differences between the countries when it comes to, if you know how to present in this particular space and create, because you're quite right, it goes to energy, physical, digital, and it goes to intensity and the experience, same thing.
That's right. Great. Thank you.
Thank you so much. Thank you so much. Now we have reached to the wrap-up section. And I want to ask all the presenters if they can wrap up the webinar. Oh, sorry, we have one raised hand here. Yes, Hannana Shaban Bulukar, yes, has raised hand. Yeah,
Hello.
Hannah, would you please start?
Hear
Yes,
me?
hello. Yes, I can.
Hello, everyone. I'm really happy for participating in this great webinar. All presentations were great, useful, and informative, and I would be really pleased to ask about, because we're in the COVID era, I have to ask about the challenges of managing an environment, learning environment, actually. I want to know about them. What are the challenges of managing a learning environment in the era of COVID-19? I would be really happy if any of these great presenters answer my question.
Okay, Dr. Jonas, please.
No, Mandana, please.
Mandana, please.
You are muted.
Yeah. It's a very hard question.
Mandana, you're such an amateur.
It's a very hard question, actually.
Yes, Mandana, please.
Overcoming the challenges that we have for the something like outdoor, for example, environment, and also interactive environment. But the things that I'm thinking about, as you mentioned, I think that we can use the some art again, because we have also produced the group of people in the Educational Development Center as a specialist who are working in the different parts of art for education. And this is actually some parts of the outdoor and also informal educational environment. And I think that, however, there is some challenges, but by the use of these methods, these art methods, I think that we can also use it through the computer. Then I think that we can be success in some senses. I hope that I could answer the question in a right manner.
And I think, I mean, I think from our end, I mean, obviously, physical proximity is a big issue when it comes to COVID-19. And the good thing is that people say, well, we don't like Zoom, we don't like the teaching. This is really good.
you can breakout rooms, you don't never any questions about space, you divide people. When they turn the cameras on, you can have great conversations here that you cannot have live. So I think that in terms of sort of what you want to do is to reduce. And I think that the way, at least I think about it, you may disagree, but the way I think about it is not hybrid. I think hybrid environments are super difficult actually to use, but I think that another type of hybrid curriculum, that certain sections are done digitally and others are done face-to-face in the same class. So it's not that you have both digital and face-to-face in the same class, but there are certain classes where you do have like digital teaching, where you, for instance, have like close proximity in terms of group work, etc., etc. So I think that from that perspective, very simple. The difficult part and the dangerous part would be physical proximity. And here, Zoom, for instance, is a very good tool. I don't know. What do you think, Amir?
Just the same. You know, I was thinking about what I have the honor to teach students about leadership courses and leadership webinars, maybe. There we emphasize on that every challenge can be turned into an opportunity. There is no dead end in life. Every phenomenon has pros and cons, and whatever happens, you have to use your mind and think about it and look at it as an opportunity, as well as the challenges it has imposed on us. Well, the virtual environment, the virtual milieu, which is imposed on us due to COVID pandemic, actually has challenges. The physical proximity, which we learn from you, actually is affected, but there are very pros into it. You know, before COVID, when we needed some referee to be present on the dissertation or the lectures who a PhD student gives, he had to take his tickets and get on the airplane and come here from 2,000 kilometers away. Right now, COVID has made it possible to be on the dissertations just from your home. Or I, as a gastroenterologist, did not have the privilege to take part in weekly, that is it, literally weekly grand rounds of American College of Gastroenterology. But right now, every Saturday night, I take part in the free webinar that is presented by university professors from Yale and Harvard and so on. So this is what COVID has handed to us. Well, you are gifted students, gifted people, and you have to think, you have to innovate onto the ways so that this physical proximity that is affected would be compensated with other ways. Of course, the digital high-tech corporations like Zoom, Google, those are also working on this. And there might be some solutions, some technological solutions for the matter, but we are not, you are gifted and we have to just find the solutions.
Yeah, I entirely agree.
Thank you so much. And Dr. Sohafur, we are here for the wrap up of the webinar, and I want to ask you and other presenters to wrap up the webinar, please.
Yes, actually, everything is so clear and very well presented. I want to ask everybody to tell his friends or her friends about what just happened tonight and the very beautiful topics that were covered. Here I just had an introduction on what clinical learning environment is actually. I have to admit that I went over the publications done by Professor Nordquist and his colleagues to have that introduction. Then dear Mandana had a presentation of her experience about one aspect of innovational learning environment intervention, how you can do with empty hands, just take the students out of class and walk and go to the park and go to the museum. That doesn't need any money. So, and she has done it. She has seen this experience abroad and has imported this kind of thinking into the university and have experience about it. So we can learn, we just learned it from Mandana, and we can think and customize it on our settings and make new solutions out of it. And then Dr. Nordquist, in his great presentation, talked about the physical proximity, the scores that McKinsey Institute has given to it, and that computer-based office work and classrooms and trainings has a high score in physical proximity. That means in the way that used to be present at our classes, physical proximity has been very important. But when the virus came, we went from face-to-face interactions onto digital only interactions in the lockdown era. So we went on to home to home or home to office or home to clinic interactions. And then right now the hybrid form has come about. So this is very challenging. This is hard. This is a mixed type of thing. You are standing in the classroom. There are several students present here in the classroom, and then our cameras, and you have to interact both to the students present in the classroom and talk to the spot, to the dot, so that people at home are seeing you and interact with you. This is challenging, but virtual space is no more a good to have thing, it is a need to have thing. So this is what we have to have. And then the focus of his remarks was what students can do when we think about the background, the camera, the angles, the lighting, the voice and sounds. This is what students can take part in shaping the environments of learning. So we learned from Dr. Nordquist that virtual learning is not just turning on Zoom and giving information and taking information. It has many parts, many aspects, many things that we have to think about: our outfit, our background, the way we present, the way the lighting is on. So we have to think about two main components. One is the experience, the feeling that students take, the milieu that we actually, this is like inviting some people to a gala dinner. When you invite a friend to your home to have dinner, you have to make preparations. You have to give him or her a good experience. You don't want him or her to be not a friendly situation. You have to make an armchair ready for her, not a stool with a hard surface. So you have to give a good experience, and then you have to instill energy, high energy, enthusiasm, the way conversation takes place into the area. And then Dr. Nordquist took us to the French and the German experience of designing an opera hall. That was marvelous when he talked about the way they were designed and the purpose they were designed for, and the goals and what is taken from the design you prepare, the socializations, the sofas, when you put students on sofas and just choose where they sit, just before you start talking, before you start the class, you have done much to make interactions and socializations active in class. Encounters and informal learnings were keywords I learned from Professor Nordquist, and they are actually marvelous. I think everything I just said was said very clearly by the presenters. Actually, I should apologize if I could not talk about them the way I should. Back to you, Marianne.
Thank you so much, my dear teacher. Yes, it was so great, and I want to say thanks to my presenters as well. And now we have 5 minutes, and if you have and other presenters have any comments or recommendation, we can hear, or if they didn't, if they don't, we can stop the webinar. And before
Mariana,
that,
can I just say that thank you, Amir, for this wonderful opening, which I think really contextualized all of it. And Mandama, you know, I almost forgotten about the BMJ and what we've done with the art museums. You know, time passes by so quickly, and I think it's so much worth revisiting to see. And I think that, you know, it's so wonderful to see these outdoor and the indoor, and what can really enhance the experience, and particularly using the art museums. And Mariam, thank you so much for sharing this session. You are such a pro. We might hire you here at Karolinska. Thank you.
Thank you so much. And I want to ask other participants and audience to turn on their webcam to have some memorial pictures for the end of this webinar. Please.
If they're dressed, you never know.
Yes, yes, absolutely.
And
If
also,
they
I
can.
would like to add that thank you all, especially our very precious guest, Professor Nordquist, that learn us something new. And thanks for all the comments that you learn us. And I hope that we can use it with some modification. However, maybe our budget is very limited, but in our country. Thank you very much.
Mm-hmm. And I say hello to Dr. Elizabeth Kapoor. Very nice to see you there. Dr. Kapoor is from New York, and she's with us in all our events. And this is very, very precious for us, Dr. Kapoor.
Yes, absolutely.
Thank you.
Well, it's a pleasure to be here. And I want to just support the idea how important Zoom is to make us all connected. I wouldn't have been able to travel to Iran so many times as I can attend these sessions, which have been really quite incredible. So I learned a lot. Thank you very much for having me.
Thank you too.
Our honor.
Yes.
It's our honor, Professor Kapoor.
Thank you so much. And do our audience turn on their webcam? I couldn't see them. Miss Sadek, are you here?
We have
Miss
7
Yes,
people
I'm here.
online.
I'm taking screenshots. Yes.
Okay.
Thank you so much. Hanan, would you please turn on your webcam as well?
Very great to see friendly faces.
Yes. Yes. Is that okay?
Yes, I take a lot.
Thank you so much.
Great.
Thanks for your cooperation, Mr. Devi from International Affairs, and many thanks for my prestigious and dear teachers, Dr. Sohrapur, Dr. Shirazi, and Professor Nurkris, many thanks, and dear Elizabeth Kapoor, Professor Kapoor, for all kindness to all. Thank you all, and have a good time and good night.
Good night.
Bye.
Thank you.
Bye-bye.
Thank you so much.
Bye-bye.
Bye.
Hope to see you later.
Sure.
Hope to see you. Bye.